We're speaking this morning to Dr. Sharifah Nur Insyirah, or Dr. Afa. Thank you so much, Dr. Afa, for speaking to us on the LITE Breakfast.
Yeah, good morning. How are you guys?
We're good, thank
We're
you.
good.
How are you?
Yeah.
How's things holding up in Sabah?
Everything is okay. Everything is okay. No worries.
Really? From what we hear, we're very concerned about Sabah.
You have to always stay positive, you see?
Right.
Yes, that's right. Now, tell us a little bit more about yourself first, Dr. Afa, before we get into details. How long have you been a doctor, and how long have you been in Sabah? Are you Sabah native?
No, I'm actually from Semenanjung, but I've stayed in Sabah for 2 years and a half now. Yeah, since 2018. I was working in Queen 1, Queen 2, and also Hospital Likas previously, but now I'm based in KK Inanam.
Okay. So they move you around at this.
Yeah.
Was it just at this point in time, or do you normally just move around hospitals in Sabah?
We have to get attached to a few departments before we are sent off to being medical officers, and we'll be here for 6 months to 1 year before we are deployed back to Semenanjung.
I see. Okay. Now, Doc, take us through what happened when cases started going up in Sabah. COVID-19 cases started going up in Sabah in September.
Happen anytime during the year. I mean, all of the people have been following the SOP and whatnot, but it's a virus that we cannot see. So either way, sometimes you don't even know that you have it unless if you have the symptoms, you see. But some people will only know that they have it when they are being swabbed. So it's probably at the end of the active phase of the virus. So yeah. We are prepared, and we foresee things might get worse within few months, but honestly we did not expect it to be like 500, 600 cases each.
What did you expect? Seriously, what was your worst case scenario? This is probably beyond worst case, I suppose.
Yeah, that's why we are understaffed, and what KKM did was they deployed staff from Semenanjung itself, and in fact I was deployed to COVID team few weeks back, where we have to go and take swab all over KK. I went to Pulau Gaya, Pulau Pondo as well. That's another story to be told. Really, the situation and such.
What's the situation there like?
In Pondo, okay.
Yeah.
We are in full PPEs, so it's really hot, and we can go to toilet. I mean, we cannot go, and we have to stay in PPE, and then we have to take a boat to Pulau Pondo. That's about 15 to 20 minutes ride, and
in PPE.
Yes, in PPE, and knowing itself the situation in Pulau Pondo. I mean, they have to walk on small little TT, small little bridge and all, and we are using PPE, so it's quite difficult for us to move, and we have to be carrying samples and all this stuff together with us. So that was really challenging, because I was thinking that please don't fall, sorry. But thank God we did not fall, no one fell, and everything was smooth lah. There's about 5 or 6 of us as a team. So we went there and swabbed a family in Pulau Pondo. Yeah.
Okay. So from here, from Semenanjung, we know that cases are rising in the hundreds.
Yes, true.
Sabah on a daily basis. How stretched are our frontliners at this moment in Sabah?
Honestly, it's really tiring. I didn't know that it was this difficult until I was deployed as a frontliner in the COVID team. Basically, we have to work. They can call us anytime for swab. For example, you see, there's team that is in charge of statistics, and they'll be based in the office, and they will have to coordinate everything, where the swab needs to be taken, how many swabs needed. And we are the ground team, where we will be deployed to all these places. So before we were deployed, they were doing all this together. So it means they have to be in the office, and in the evening they will have to go and take swabs as well. So that's why when they deploy us, it helps a little bit, but yeah, the working hours are really different compared to just before all this happened.
Yeah. And there were a lot of healthcare workers in Sabah that were quarantined as well because they were in close contact with COVID-19 positive cases. So that
Yeah.
sort of, how to say, made the manpower that was already stretched even more stretched thin because there's so many people in quarantine. Is that true?
That's the thing. Myself, I've been swabbed for almost 15 times already.
What? Oh my God.
Yeah,
Your
I know.
nose must be painful now or numb.
The thing is, before we, from one department to another department, or from the hospital to a clinic, we have to be swabbed. I mean, the healthcare worker have to be swabbed so that we know that we are negative before we, attend patient and whatnot. So, and then when there's cases such as if we didn't know that the patient was positive. I mean, we are in full PPE and everything with N95, but then maybe within 2 weeks after that, we got to know that one of the patients are positive. So we have to be swabbed. But nowadays we have RTK, which is only a few hours, takes only a few hours. So if we're negative, we are back to work. No issue about that.
Okay. Can you share with us some stories of patients that you have treated with COVID-19?
Oh, okay. The thing is, it's how they see things. Some patients, they are scared. They are scared of the outcome of COVID-19 to them because they don't really know what will happen. Yeah. Because some of the patients that I've seen for the past 8 months, most of them have symptoms. Most of them have symptoms such as fever, fever, but some lost sense of taste, sense of smell, and headache and body ache. All these things, sometimes you don't really realize it, you don't pick it up until after a few days or a few weeks, then you realize that, oh, it's actually COVID, but you didn't know. Okay. Most of the patients are scared to be swabbed because people tend to tell them that it's very painful, but actually there's a technique of, I have been swabbed for 15 times, so I found to reduce the pain. So basically you just have to lay back and then take a deep breath. So it's about 10 seconds of procedure. So do not move, and it's better if you close your eyes. But sometimes it's gonna be kind of weird. Like you're staring at the patient eye, for 10 seconds. Yeah, and then they started crying and everything. But it's just a reflex of the swab. It's not that painful. You can ask.
Okay. Because you've done it 15 times.
15 times.
Yeah, because even until now, I think whenever someone contracts COVID-19, they think that it is a death sentence. It's like, oh no, I'm going to die.
Yeah, that's the mindset that they have previously. You see, maybe in January or February when we don't really know what COVID is. But studies are still ongoing. They're still studying. Some say there's a lot of myths saying that, oh, maybe if you stay under the sun, it will prevent the COVID from spreading and whatnot. And all these things, people are still studying. It's still under study. No one really knows the exact thing that could prevent it. But we do know that this virus cannot stand a very hot temperature, a high temperature. So as long as you maintain your social distancing and then wash your hands regularly, don't touch your face, touch your eyes, or you just have to maintain your hygiene. I think it should be fine. Yeah.
But Dr. Alpha, in the early stages, we've heard of all these patients going through some really tough times with breathing and whatnot. And then now we hear the recovery rate is pretty high. Are there still patients who are going through really tough times? Have you seen it in Sabah?
Yeah, the thing is, we are worried more about elderly patient, or ones that have comorbid such as maybe hypertension, diabetes, or chronic diseases such as cancer. All these patients that is immunocompromised,
right?
Asthma and whatnot. So we are worried about them because normally the young patient, the one that I've seen, it's just like a mild cold or flu. Like I said, they won't realize it, and then as time goes by, they develop like an immune system, or maybe something that causes it to, after few weeks, it will go away. There's not really something you can see after 1 or 2 days. It takes time for it to recover. Yeah.
Okay. So it's the older patients that you are worried about, and those are the ones who have to be in ICU most of the time.
that we need to be that need to be focused on. Yeah.
So the ones that you've dealt with predominantly are mildly symptomatic?
Yeah, there's stage 1, stage 2 with symptoms and without symptoms. But then we also have to be careful. Sometimes with the one without symptoms and are mildly symptomatic, you can say, they might develop to something worse if you they might have suddenly a shortness of breath or something like that. So you have to always contact them and ask how they are, you know. We have Inspector Kesihatan IKs working, calling patient and asking if they have any difficulty in breathing, if anything is happening and anything is worsening. Yeah.
How are you and your fellow colleagues over there in Sabah right now? How are you guys coping mentally, physically?
We're trying to stay positive. I mean, we as a frontliner, I know we get tired. I know we get, afraid and all of those things, but we have to show positivity. I mean, we cannot say that, oh, this thing's gonna be bad or something like that. We know the situation is bad, but you always have to stay positive and we have to know that we can win this. I mean, we did it before, right? And then if others can do it, why not Malaysia? I mean, yeah.
What's your day-to-day schedule like right now, Dr. Alpha?
I'm back.
Now that you're in the clinic Kesihatan.
Now I'm back to clinic Kesihatan. So we are gonna have a lot of post-COVID, COVID positive patient that has already, negative. So they're gonna be follow up under KK, our clinic Kesihatan. So we have like a new system, and we have to assess their well-being after discharge. After discharge from the hospital. See if everything is okay, because they're already negative, so they have to be followed up under clinic Kesihatan, because they cannot hospital. They are focused on positive COVID patient for now.
But for those who are on the front lines right now, how crazy was your schedule when you were doing it?
Last few weeks it was quite tough. I can say it was quite tough, but with the help of other people, I mean, we've been receiving food and a lot of stuff from NGOs, supporting all the frontliners, giving us positive support and everything. So yeah, we're trying to stay as positive as we can and just go through everything together.
Yeah, but I'm pretty sure you've seen all the social media posts that people are putting out. It's like panic situation in Sabah. Things are really bad. People have no beds and this, that. How do you stay positive when you see all of that?
That's the thing about doctors. You have to always stay when we see these kind of things. But regarding the beds and all, the government are trying their best to supply all the help needed. And in Likas itself, they open a quarantine center for patients. There are mild symptomatic. They have to be there they will be under surveillance and supervision of doctors who are working 24 hours. I mean, they have shift, but they are working. They're always there. So yeah.
What is lacking right now in Sabah, doctor? Do you have enough PPEs? Are there any medical equipment that's lacking, or maybe food being sent to people in the pedalaman maybe?
For now, in KK itself, just last week and 2 days ago, we've been receiving food from NGOs, and some of them are just normal citizens that are willing to help. And they know that we've been working, a different time.
Different shifts, yeah.
So yeah, they support in that sense. And I have some of the people contacting me and asking, how do we help, doctor? How can we help? So last week there's this one lady that gave a wheelchair. I mean, something you see it as something simple, but it actually helped a lot. I mean, people are too focused on COVID patient when they didn't realize that we also have other patient that is not COVID positive, but is having cancer, is having diabetes, major diabetes problem, and that other chronic diseases. So we need help in that sense as well. So yeah.
Understood. Yeah, everyone's just worried about the COVID-19 situation in Sabah, that they've forgotten that there are other patients as well.
And some of appointment in hospital have to be rescheduled because we do not allow patient to just simply go to the hospital without the need, unless it's really an emergency cases, and most of the patient will be swabbed before they're sent to hospital.
Actually, I was just thinking about that. I mean, for some mothers who have to deliver babies and whatnot, how does that work right now? Because most hospitals have become COVID hospitals, right?
That's the thing. We have already prepared an OT for emergency cases, such as patient is really in emergency. It means we cannot wait for any swab to be done or anything. The patient will straight away go to operation theater, but all the staff and all the doctors will be in full suit PPE. So it's positive COVID until proven otherwise. So maybe it's a negative case, but then we are fully prepared and protect ourselves. Yeah. So
is it true that like everyone you know or people around you, like someone you know or someone's family member that you know has COVID-19 in Sabah now?
I have my staff nurses. Yeah, I knew some of them, but I do ask them. I mean, do they have any symptoms or anything? They had like a mild fever, and they don't really know where they got it from. It's probably from outside. It's probably not from Malaysia. I just don't know. Maybe when you're out buying groceries or something like that. But we can't really blame these people because we can't see the virus. You see. Yeah, I mean the mindset of people nowadays, or when you're positive COVID, people start blaming you, saying, "Oh, you didn't do this, you didn't do that." But we are not in their position. We don't know what they've been through. I mean the stress they're at. So we have to keep supporting each other. You know, yeah, be a family.
Actually, for your staff who contracted COVID, who they weren't allowed to work obviously, and then they got better, and then they came back to work. Was there any stigma like, they've contracted COVID before, would they be more contagious, or
That's the thing. That's why we always as a secret, when we found patient is positive COVID. But some of them are willing to share it on social media. I mean, it's their right if they want to share. Stigma, I think not really, because they're already negative, so it means they're already healthy and safe, just like you. Just like they've been through this before, and we just don't know that we might be positive. It's just that we didn't get swabbed, so they didn't know,
But why is it like once they've tested negative, why is it that sometimes, I remember this was back during MCO, they still had to quarantine for another 2 weeks at home before they're allowed to go out?
Actually, in February and March and April, I mean back a few months ago, they have to be swabbed. If it's positive, they'll be quarantined or warded, and subsequently every 48 hours they have to be swabbed again until their result are ×2 negative. Means they're negative and negative, and then they can be discharged, but still have to be quarantined. And on day 13, they have to be swabbed again.
Correct. That was the SOP then. So the SOPs now, they are different?
Because previously we don't know we are not sure what we're dealing with previously, but nowadays all the studies have been going on and whatnot. So we know that some patient might still be positive, but the percentage of the virus is less than 20% or 15%, and they're bound to be negative on the next swab. You see. So the quarantine period will be 2 weeks, and then it's okay. They're free to go, and then they just follow up with the KK. Yeah.
Okay. Have you seen any reinfected patients in your clinic kesihatan?
Yeah, no. So far, no, because my start coming this Friday. Yeah, because we are divided into few zones. Some people say that once you're infected with COVID, you're not bound to get it again, but some say that there might be possibility. So it's really an uncertainty. You see, everything is still under studies and whatnot. But you just, as long as you maintain your hygiene and your social distancing and sanitize your hand and everything, I think it should be okay.
Okay. Now, doctor, as a medical professional, what message do you have to Sabahans battling this pandemic right now?
Yeah, I know all of frontliners are sometimes scared and tired, like I told you before. But right now, we have to stand together. I mean, be strong and be positive. We know that we can get through this as I told you before, we win this battle before. And as you know, the number of people being negative again is getting higher each day. So I know that we can beat this. We can do this. Yeah, we can do this.
Yeah.
Just stay safe.
Yeah. How about to the rest of Malaysia? Do you have like any advice to the rest of Malaysia, especially since we're going through this third wave of pandemic right now?
Learn from what you have to learn from what happened before. So we don't want this to be affecting other states, after Sabah. So we have to, just like I said, we have to maintain our social distancing. We have to maintain all the SOPs, and just your prayers for all the Sabahans that's going through this is really means a lot to us. Yeah.
Dr. Alpha, I just was talking to you, right? You had a bout of COVID as well, didn't you?
Sorry?
Did you go through COVID as well? Were you positive at one point?
I was in March, April. Yeah, I was one of the first to be positive. Yeah. That
Right.
was. We don't know what happened before, so we were, like I told just now, we were quarantined for almost 1 month. Yeah, for my case, almost 1 month. Yeah.
Did you
But-
experience any symptoms at that time, or were you asymptomatic?
Like I said, we didn't realize it was actually COVID. I was healthy actually. I didn't experience anything. There was like a mild fever, but we did not expect it's gonna be COVID. But we were swabbed, so my first swab came back positive. So and then from there, I was sent to the hospital, and I was there for 2 weeks before I was discharged to the quarantine center. Yeah.
I asked only because I'm wondering, because people are getting they get a little bit of fever because the weather's a bit weird now. It's hot, and then after it rains and everything. Should we be assuming that we have COVID every time we get like a little bit of fever and a little bit of body pains and sore throat?
If you have been exposed to, if you think you are exposed to a high risk patient, or you think that this is something different, from what I experienced, the feeling you feel like the body ache is not like a normal body ache. It's really painful. Yeah, the body is really painful. You can't even walk. I mean, yeah, that's
Right.
one of. So if you think you've been exposed and you have the risk of getting COVID, it's better if you quarantine yourself and get yourself swabbed. Yeah.
Okay.
To yeah.
Just to be on the safe side.
Yeah.
Yeah.
I
Takut
think
lah,
you-
the swab.
I think you've answered this question for us already earlier, Dr. Afa, but just in case, what do you need? What does Sabah need right now the most?
I think you mean like technical wise.
Yeah,
or-
what can we do to help? Like,
Money.
yeah, should we donate money to these NGOs to continue, providing medical equipment, or is food needed for the people in the kampongs or in the pedalamans?
Junk food to keep people's
Ah.
spirits up.
What is
Yeah.
needed the most now in Sabah?
Because for us, PKPD, I mean, we can still go out and buy stuff, but then like you said, for people in the village or some kampong area, it's not easy. I mean, they cannot go and work. I mean, they're stay at home, and then they don't have money to buy food. So that'll be a great thing if all the NGOs can donate food and maybe rice, beras, and all the necessary stuff for daily. Yeah, for us, the frontliners, a lot of help has been given, especially like food and stuff. My friends are receiving a lot of food and they're really happy. I mean, these small things means a lot to us. Yeah.
All right. Well,
All right.
thank you so much, Dr. Afa, for your sacrifice.
Yeah.
And yeah, we're keeping all of
Before-
you. Yeah, go
Yeah.
ahead.
Yeah, I've been through this before, and now that I can help people, and I know what they've been through because I've been through it before. So yeah, you can do this. I mean, we can really win this.
Yes,
Right.
our thoughts and prayers are with everyone in Sabah.
Yeah.
And I'm sure eventually we will win this.
Yes, true.
Yeah.
The reason why we're doing this because we're in Peninsula. We hear all these stories. We're like panicking. Our friends in Sabah, like, is it like World War Z or whatever going on over there? And
No,
I said,
because we get news from people in Sabah saying that, you know, everyone we know has COVID.
Yeah.
Or every other person out there has COVID.
Yeah.
And they're going out as per usual. They're not following SOPs.
we don't
So
know what
just
the
want
real
to-
story is.
Yeah, we just want to get the real story.
But
Are they following SOPs? Do you like when you
Yeah.
go out? Do you see that Sabahans are following SOPs?
They are really following SOP. No one is outside. No one is doing anything. I mean, not to say that just go outside, and all the malls are closed. So people are staying at home, and they just come out. It's like this patient, they came just for their checkup. I mean, we have the date given for them to come, and if they're okay, they won't like simply go out. So they're learning from the experience. Yeah, they themselves are scared. So sometimes it's good to be a little scared so that you tend to be more careful.
Yeah. Be OCD, be a little bit paranoid around this time, right? Yeah.
Just wash
I
your
mean-
hands.
I mean, they disinfected Mount Kinabalu for crying out loud. Right? Was it before or after you went up there?
That was after we
Right.
went there. That was when we went. Everything was okay already. Yeah, that was after.
Awesome.
Sometimes it's good that you're scared. I mean, you just don't know. We just don't know what we're facing and dealing with. So it's better to be safe than
Exactly.
sorry.
Being a little bit OCD is always it's okay. It's always quite good. You know what I mean?
Yeah, true.